Hello, everyone, and welcome to another episode of Community Catalyst. I am your host, Lynn Boyer, the Executive Director of Community Impact here at the YMCA of Greater Nashua. And I'm happy to welcome my guests from Harbor Care today. If you'd like to introduce yourself.
Hi, my name is Henry Och, and I'm the Chief Executive Officer of Harbor Care out of Nashua, New Hampshire.
Great, thank you, and welcome, Henry. We met recently to see how we could further deepen our partnership, which we'll get to in a minute. But first of all, please share with us what is Harbor Care, who do you serve, where are you located, what kind of programs you offer, all of that.
Okay, so Harbor Care is an agency that's working towards breaking the cycle of homelessness. We have been around for 40 years. We were established in Nashua, New Hampshire, with initially one group home. And since then, we have grown our programs to have services essentially across the state, but with a focus in and around the Greater Nashua area. So we provide three distinct service lines, the first of which is housing. We provide housing and housing supports to over 1,000 households across the state of New Hampshire. Again, most of those supports are in and around the Greater Nashua area, but we have facilities out in Claremont, Antrim, and as far north as Plymouth, New Hampshire. We also provide healthcare services, primary care, behavioral health services, addiction treatment, and dental services. Within the addiction treatment category, we provide outpatient treatment for individuals, and we also have a licensed 65-bed facility in Nashua providing addiction treatment to pregnant and parenting women. And we have within that program the ability to provide that treatment for up to a year for the individuals enrolled. Our third service line is focused on providing supports to homeless military veterans. And the types of supports that we provide include transitional housing, permanent housing, job training, suicide prevention, and we also work with many community partners to bring other resources together for the 450 veterans that we provide support to on an annual basis. I'm going to go back to healthcare for just a second. We do provide those healthcare services to over 3,000 individuals annually. And our healthcare programs are focused in and around the Greater Nashua area. Our veteran programs, our focus is really statewide.
That's great. Yeah, it sounds like you guys are definitely impacting a lot of the community and different marginalized communities too, which is really wonderful to hear. Where do you get your funding from to be able to offer these services?
So we have a lot of support from the federal government. Our housing programs are primarily funded by the Office of Housing and Urban Development, or HUD. And our healthcare programs are supported by the Health Resources Services Administration, or HRSA, lots of acronyms.
Yeah.
And our veteran programs are supported by the Veterans Administration as well as the Department of Labor.
Great. Yeah, that's great. And so even though you offer so many different services, just as the Y knows, we can't do it alone, right? We have to lean on each other. We have to support each other, which just kind of leads me to my next question about our partnership. So our two organizations have supported each other for a long time, but we've both kind of changed over the years, especially post-COVID. So what are some of the ways that you are aware of our partnership?
So I'll touch upon two themes there. One of which is I'll start off with a story. So when I first joined Harbor Care, which was 4 years ago, we were working with a transitional housing program that we operated here, and a wonderful story was shared with me. It's a story about an individual, which we'll call Michael. And Michael was suffering from severe mental illness for a long time, as well as other ailments. He was helped out by many providers across the state and had very limited success. Ultimately, he was admitted into the Hampshire hospital, an acute care psychiatric hospital. And during his stay there, he was referred to us. And he was referred specifically to one of our transitional housing programs. So he came on board, and we leveraged all the services that we had available to try to help him. Now, some of those services included connection to the clinic and also connection to a program that we called functional support services. Now, they worked with him to go to the supermarkets to buy, help him identify and buy healthy foods. But what they also did was they got him a membership to the Y. And took him to the Y so he can begin to engage in healthy activities. And ultimately, he was with us for about 2 years, and he moved on to independent living here in the Nashua community where he is now. Now, here's the remarkable thing about this story. Prior to him getting connected with Harbor Care and the community partners to include the Y, he was either admitted to the emergency department or admitted into the hospital in general over 100 times in a near 7-year period. During the 2 years that he was engaged with Harbor Care and its community partners, he did not visit the hospital once.
Wow, that's amazing.
Yeah.
Yeah,
So
it's great to hear.
it's needless to say that the impact of his quality of life was quite profound.
Yeah, absolutely. And that's really my goal with our community partners, is to find those gaps with each other of the services that we maybe are not the experts in or not able to offer. And so working together to fill those gaps for the people we serve is so important. So it's so nice to hear that we were able to do that with this individual. And I'm sure there's many other people that, fall within the same boat with that. So that's really great to hear. And as you know, Henry, when we are taking care of people in our community, it's the whole self. And so, Harbor Care is able to take care of obviously some of those basic needs, but then the Y can fill in the gap, for other basic needs, and then vice versa, right? So we don't do housing and we don't do therapeutic services, but we partner with those that do and are good at it and help address that whole self-care. So that's really great to hear. I love that. And I know that we're looking to partner in some other ways as well in the future. And like we talked about before, you have that the healthcare van. And I know that we have a lot of members that rely on that too.
Yes, so we do have a mobile clinic. Currently, we're using the clinic for outreach as well as community vaccination efforts, and we really leaned on that clinic to support our COVID-19 response. We were able to really provide much needed support to marginalized populations during that period of time.
Yeah. Yeah, that's a really great benefit for the community, for everyone, absolutely. So anything that Harbor Care has coming up, any sort of fundraiser or events or anything that you want to share?
Well, we just had a fantastic event at our 45 High Street location. It was our Thanksgiving Day, our annual Thanksgiving Day meal. We had a little bit of a challenge with the weather. It's rainy. It's rainy today. It was rainy that day, but we did get nearly 100 individuals to stop by for a warm meal, which was provided by the Common Man restaurant. We did have Governor Sununu present, Governor-elect Ayotte, Senator Shaheen, Congressman Pappas, and Congresswoman Custer show up, as well as Mayor Doncha. So we had all of them serving food for members of the community alongside other community partners.
Yeah, that's great. That's wonderful service that you can offer for people too. That's wonderful. And before we go, any one thing, if there was one thing that you would want our audience members to take away with regarding your organization, what would it be? I know that's a hard question.
Yeah. Well, if it's okay, I'll probably talk about two items.
Sure.
Okay. I'll talk a little bit about something that we're working on right now within the Manchester community. We're working with Mayor Rouet to put together a plan to end military veteran homelessness within that community, and that doesn't mean that there'll never be another homeless veteran, but what it means is that we have the systems in place to rapidly identify and provide services to individuals in need. We actually achieved that designation in 2017 here in Nashua, and we believe that we can work with the community in Manchester to achieve that there. It's not easy. It requires community partnerships and support from elected officials. So we're very excited about that. As far as another item that we're very proud of, since beginning in April of 2020, so this is really the beginning of the pandemic, and up until today, we have been working on identifying individuals who are experiencing chronic homelessness. Those are individuals that have been homeless for extended periods of time or had been homeless multiple periods of time, broken up into many, many years. Those are the individuals that are the most vulnerable within our communities. And over the span of what's now over 3 years, we have been able to provide permanent housing to over 200 previously homeless households, and under very difficult market conditions, specifically with housing. So we've been very, very proud of that accomplishment.
Yeah, that's really great to hear. And yeah, to your point, we all know the housing in New England and New Hampshire specifically is challenging. It's really challenging right now. So I definitely commend you for being able to do that and support people in our community that need that. So that's great. Well, thank you so much for joining us. I, again, really appreciate our partnership, and I'm really looking forward to deepening that partnership. More to come, more to come
Yes.
with that. So we definitely value our partnership with you and the work that you do too. So
Thank you.
thank you so much for joining me. And to our audience, thank you for joining and listening in. Please check out Harbor Care. Do you have a website, Henry, that they can
Yes.
check it out?
HarborCareNH.org.
Yes, and come on by to the mobile health clinic. It's at the Y quite often, and say hello. And I will see you next time on Community Catalyst.